Okay, so now we're going to talk about the tube feeding bag, the enteral feeding bag. I'll let you see. This particular brand says the Gravity feeding set. They all basically look the same. Now in the hospitals, you're more likely to see the exact same bag and tubing attachment, but it's got a portion of the tubing that's set to go in a feeding pump. And the pump is what's going to control the rate or how fast this goes into the patient's stomach. So what comes in this is a bag pre-attached to tubing with then an end piece that's going to connect to either our nasogastric tube or to our G-tube, whichever one we're using. Now there's a couple of parts on this bag or on this set. The bag itself has measurements on it. We typically measure out the enteral feeding that we're going to use. It either comes in a can or it comes in a bag or some other container, and we pour it into the top of this bag. We close the lid and it's pre-measured for us, so we know how much is going to be in there. Right below the bag is what's called a drip chamber. And so whenever we do any type of gravity infusion, we have to actually be able to see the drips. We're going to learn about this again week 13. We're going to be talking about IV infusions using the drip chamber instead of using a pump that controls how fast it goes. We use counting the drops that are falling as determining how fast it's going to go in the patient. And how we control how fast it goes in on the tubing itself. And sorry, when you get these out of the bag, there's always some kind of paper thing holding it together. You can take that out and straighten your tubing out. But on your tubing, for tube feeding and in the future for IV tubing, there's always this roller clamp. And the roller clamp is how you adjust whether anything's flowing through the tube or not. So if we roll the clamp all the way down to the narrow part, I'll roll it down with my thumb, that closes or clamps it. If I roll it back up, that opens this tube and stuff will flow freely through it. This is essentially a pump. This is the old way of doing pumps. Nowadays you'll see in the video and in practice that we use electronic pumps to control the flow of fluids into the patient's body because, number one, it's more accurate and it's safer. And they have alarms that will go off if there's some problem with the infusion. But for us, we're going to be talking about the gravity flow rate. All right, and then there's a cap, protective cap, just to keep this clean. Now, this is not a sterile procedure, right? I'm going to wear gloves because I have some potential for body fluids to come out of one of these tubes and get on my hands, so I'm going to be wearing gloves. But this is not sterile. This is just keeping the tip of this clean because we're using the gastrointestinal tract, which is not sterile at all. So we don't have to worry about wearing sterile gloves or doing sterile stuff with this. Okay.